Hi, my name is Dr. Susanna Lynn. I'm a licensed physical therapist in the state of Washington. This video is to treat numbness when you have numbness in your hands, okay? Now, it is very important when you have numbness that you do go see a doctor or a physical therapist. Make sure you get checked out. It is something that if the numbness goes on for too long, there's a possibility, the nerve is being pinched, not getting enough blood flow, and there is possibility of permanent damage. So it is important to go get checked out if you do have numbness in your hands, okay? But this is a pretty safe program that you can do at home to help treat the numbness, okay? So I'm gonna have 3 nerve flosses for the 3 different nerves that go down your arm, and then 1 stretch. So the first nerve floss is for your ulnar nerve, okay? So you're going to be in this position, and then you're just going to go side to side. And you're gonna do that till you feel maybe a little bit of tension, okay? And come back. Do it slow, because we're working on the nerves. We don't want it to zing you, okay? And just kind of go to the point where you start to feel some tension and then come off of it. Don't push it too far where it's really uncomfortable. Okay, so you'll just do this between 10 and 20 times, okay? Just like this. Make sure you're not shrugging your shoulders in any of these. The shoulders should stay down, okay? The second one is for your median nerve, okay? So you're gonna start in this position, and I'm gonna have you turn your head away from your hand, okay? And then you're gonna come out like this. Now, you might not make it all the way down, okay? You're going to stop at whatever point you start to feel tension. So if you start to feel tension here, that's where you're stopping, okay? So, but the end goal, where you're going towards, is here, okay? So you stop wherever you feel the tension, and you'll do about 10 of these, like this. And I've lost count, but I'm gonna do about 3 more. And then the last nerve floss is for your radial nerve. This one's a little tricky to get the right position. You're gonna start like this. Make sure your hand is curved like this, okay? And then you're going to come down and come at about a 45-degree angle, and see if you can kind of find that spot where you start to feel some tension, okay? So you're gonna come back. So I'm going behind my body, but also out to the side. And again, wherever it is in the range that you feel the tension is where you should stop. And we'll do about 10 of these. And again, I'm not exactly sure on the count, but you can do 10 at home. Between 10 and 20, I don't want to overdo it because it is a nerve. Good. The last one's a stretch. So we're going to stretch our chest muscles. The nerves come down, start from our neck and then come down our arms. And when we have tight chest muscles, when we have poor posture, the nerves can sometimes get caught in these chest muscles or pinched with the tight chest muscles. So posture is going to be an important thing when you have hand numbness. Make sure you have good upright posture. And in order to stretch those chest muscles, we're going to lay on your back in this figure Y position, okay? And if you can't quite reach the ground with this, you could put a few pillows under your hands, but make sure you're in the point that you're feeling a stretch, but it's a comfortable stretch that you can just lay here for a while. And like I said, if you're too tight, if your arms are up like this, put a few pillows under your hands, but not so much that you don't feel a stretch, okay? So you're gonna lay in this position, and I typically tell my patients to lay here for about 5 minutes, 5 or 10 minutes. If you start to feel numbness while you're in this position in your hands, then that's actually a good sign that this is a good exercise for you. So, because it's telling us that those tight muscles in your chest are actually pinching on the nerve. If it's just very slight, mild numbness, then just hang out here. If the numbness gets kind of strong, then just bring your arms down, give yourself a moment, kind of let that numbness go away, okay? Wait for the numbness to kind of go away, and then go back up, okay? And what you'll find, if this is going to work for you, if this program is going to work for you, I'm going to sit up, but if this program is going to work for you, what you'll find is that, you know, over a week or two, you'll probably start to notice a little bit of improvement. Over a month, you should notice a decent amount of improvement, if not mostly gone, okay? You'll notice when you're laying in this position, if you're doing this like every day and you're laying in this stretching position, after a week, 2 weeks, you know, as time goes on, you'll be able to lay here longer with less numbness, and that usually will also correlate with having less numbness during the day, okay? But definitely this is, you know, a condition that you would see the doctor in. If you're having any sharp shooting pains with any of these exercises, don't do them. You might feel a little bit of tension at the end range, but don't do anything that is sharp or shooting pains down your arm. Or if you're having shoulder issues, some of the nerve flosses might not be possible. Okay? Thank you.